I'll give you a quick overview of what it is we're doing and why we're doing it. And look, as has been said, whilst I work in IT, this is not an IT project. This is purely a clinical transformation activity. It is not about IT and widgets and things that plug together. It's about how do we provide a tool that helps our clinical colleagues across the ACT public health system provide exceptional care to all of us. Every time we go there to the hospital or the health system, or our family, or our friends, or people we haven't yet met. So it's important. These are the key things we need to focus on. So why are we doing this? It's all part of the digital health strategy, which is looking at very much, we have a plan, we have a whole roadmap mapped out of how we can actually use technology to enable clinicians to provide exceptional care. If you want, you can have a read of it today. I can give you a 5-minute summary anytime you like. It's available online, and many of you in the room or online were actually involved in developing this digital health strategy with us. And fundamentally, the most important single thing about it, enabling exemplary person-centred care through digital innovation. That's the entire reason for this. That's why technology is involved in healthcare. That's why we're doing all of these things. It's not because I get excited by widgets, I don't. It's because it actually helps people provide better health outcomes. So, the digital health record very much is all around focusing on what actually matters for patients and consumers and clinicians. You can look at it from a Tolkien way, one system to rule them all. Fundamentally, the idea is it's one single system that gives clinicians at their fingertips the information they need to help provide better care for the patients that they have in front of them. And that's one single system, whether they work at QE2 or Calvary or Canberra Hospital, or University of Canberra Hospital, or in a community health centre, or in Justice Health site, or anywhere else across, in fact, even South East New South Wales, as some of the services reach right into New South Wales. One single system about each and every one of us. And it's a system that's actually intelligent and smart and actually helps them do their jobs. And that's what it is. Currently, we have over 254 ICT systems in ACT public health system that I know about, and I'm sure there's a whole lot of other ones I've never yet come across. And that's kind of crazy when you think at times we can expect a nurse on a shift to actually access up to 20 or 30 different systems in a day to do their job. And the digital health record is a very big part of transforming that. And there's a huge range of other things that will go with it in terms of a technology perspective, but also in terms of how we'll actually change the way care is provided. So, we've chosen a system. Sooner or later, if you're going to roll out something like this, you actually have to choose one. We chose Epic. Fundamentally, many of you were involved in this. This was a decision that was made around what mattered and what would help us improve the ACT public health system. And so we look at it. Epic really are working with us. They are our partner, and it sounds kind of silly, and most of you know I don't do cutesy stuff particularly well. What I find vaguely disturbing, but also really speaks volumes towards their mentality, is every time a new customer joins the Epic family, they actually play a wedding march across their main campus in Wisconsin. So clearly I've drunk the Kool-Aid and I'm there, but I think it is a fundamentally different approach than that we have with any other software vendor we've ever worked with. And it really is around coming along that journey with us. And that really is an important key thing for us. It's a 10-year contract with an option for an additional 10 years. This will take us a couple of years to put in. In fact, we're going live next year, which already seems like tomorrow. But we're there for the long haul. This is not something we're going to put in, go, no, you know what, we didn't like that, and pull it out in 3 years' time. This is a long-term commitment from all of us across the sector, and it really is focused around what will deliver best for our patients. Thankfully, we're not the only ones who are going down this path, and we'll talk a bit more about Epic as we go through, but fundamentally they're now becoming one of the biggest vendors of such software in the world, and increasingly coming across Australia. There's a whole range of things that we can do here. What actually matters is it's focused around patients, it's focused around clinicians, and it's focused on being integrated. So you don't do one thing in isolation. Everything flows together in the same way that the healthcare provided to our consumers is all integrated, and the system mimics that. We went through a fairly robust procurement process. Those of you who have been involved in government procurement know what an exciting thing it is. I get just thrilled the idea of having to read 10,000 pages in a couple of weeks. We chose Epic for a whole range of reasons, and it was a very hotly contested procurement. But the number one reason we chose it was based on the view of the tender evaluation team, which I might note was also majority clinicians, And based on all the feedback that came through the various town hall sessions we ran, the feedback that was provided through those sessions, the voting that occurred through that process from all those clinical colleagues and administrative staff across the system, that this was the system that would best enable them to provide exemplary care. It's as simple as that. This isn't about going for the cheapest solution we can find or the one with the shiniest toy or whatever else. We chose Epic fundamentally because it actually will help each and every one of you transform the care that's provided across the ACT. And that's the real reason we went with Epic. It's as simple as that. There's a whole lot of people involved in this, and the team is somewhat large. We have over 300 subject matter experts who are working with us. We also have 130, 140 people in the Digital Health Record program team, and now I get to embarrass them all, and we'll see if they remember their chairs flip up and down. Key people who are leading it, Rebecca Heeland, our Chief Nursing and Midwifery Information Officer. Associate Professor Essex, Rowan's our Chief Medical Information Officer. Sandra Cook, Executive Branch Manager for Future Capability. And the two people who actually try to dodge me almost every single day, who do the nuts and bolts, Philippa Kirkpatrick, who's leading the implementation side, and Christina Carroll, who's leading the technical side. Christina gets to do all the stuff that's fundamentally boring to us, but without that, like a network and devices and integration, it kind of wouldn't work. What's important to note is out of this, if you look at everyone up there, there's only two people up there who don't have a background as either clinicians or scientists or still actively practicing. There's only two of us that don't. And this is a clinically led program, and that's really important to remember. This is a clinical transformation of activity across the public health system. It's not an IT project. If it's an IT project, I can put it in 3 months later, move on, waste a whole lot of money and achieve nothing. And that's why we have clinicians leading these various elements, and that's why we have the subject matter expert process we have. We also have a whole range of other people in the team. We have over 30 nurses who have now joined us, and that's a really exciting thing. We have 3 doctors on the program. I'd love to have 30, but once again, I can't afford it. 26 allied health professionals. Now, it's not quite one allied health professional for every profession we have in the ACT, but we're getting close, and I'll keep working on getting more on board. We have 9 staff who are experts in various support services in hospital administration areas. We have more than 350 subject matter experts and over 60 working groups. Let me be really clear. This is your system, this is your transformation project. I'm simply here to provide the administrative process to make it actually happen, to enable you to do that. The governance process is also set up, so we have the program board, which is overarching across the top of it. 2/3 of the members are clinicians. And that really gives you a view of how we're focusing this, how we're structuring it. There are over 60 groups then that sit underneath this, and it goes across processes inside CHS, inside Calvary, across the territory through all the working groups and committees. But at its heart, it's clinical. And the subject matter experts, I need to thank you ahead of time. I need to remind you not to hate me when we get into this, because we will be very, very, very imposing on your time at certain times. Other times I'll leave you alone for weeks on end. But every single minute you put into this program will actually help us make sure that it meets your needs and that it improves the care that you're able to offer. So thank you very much. You'll be an amazing resource as we go live. I expect almost each and every one of you will be constantly emailing me saying, Peter, this is a really dumb idea, why did you do that? At which point, that's where I get to try and unpick something stupid I've done. But really, you are the heart and the soul of the project, and you'll be guiding us every step of the way. And that really matters. So, you've almost heard enough from me. I'll get off the stage in a moment. 100 direction setting sessions. We're kicking off. This is happening. We go live in September next year. That's literally almost, it feels like the blink of an eye. So get involved. There's a whole process. There's mailing lists. There's all sorts of engagement. You get to come along, kick the tyres, try the software and go, yep, I love that and I hate those 5 things. That's the aim of these sessions, to start telling us where you want it to go, how you want it to work, and so forth. So your engagement there is critical. Yes, it will be an impost on your time, but the return you'll see many, many, many times over. And it really is critical to ensuring we meet your needs. So I said we're going live in September 2022, and we are, and that's terrifyingly close. What it means is by the beginning of this year, we've started, we've onboarded. As of tomorrow, the project team go through doing all their online certification and their training and their exams, and I wish them luck. The pass marks are quite high, 80% for some of them. So it will keep the project team members busy. We start building the system middle of this year, and we have a year to build it. The middle of next year, we need to be pretty much locked down. We're getting ready to go live. So we'll have a few months to get ready for this, and then we've got a 12-month sprint, and it's going to be a sprint for 12 whole long months. Thankfully, there's nothing else happening that's distracting us, whether it's COVID-19 or critical services building and so forth at Canberra Hospital, but we'll be at a 12-month sprint. But at the end of it, we will train over 10,000 people across the ACT public health system, and we will go live in September, and we're doing a big bang approach. And it's really important to recognise what I mean by big bang approach. We are going to rip and replace, on day one, over 35 systems. And these are systems that most people use every single day in their job. They will all be removed. Those 35 systems are responsible for nearly 90% of the data processing we do across the health system. So it's a smaller number than the 250 I quoted before, but they're all the key ones. And that includes the patient administration system. That includes everything that mostly happens on a ward. That includes pathology, where we're putting in Beaker. That also includes medical imaging, where we're replacing IDIS with Radiant, which is the Epic module for medical imaging. So this is a whole transformation of our healthcare system and a whole new technology platform, but it's exciting. So that's enough from me. You actually came today to hear from people that actually know what they're doing and have done it before. And we're very much designed today to be focused around what will you as clinicians actually see? What will you gain from this? What will you be able to do that you couldn't do previously? And what will your patients benefit from? And so we structured the program very much today to hear from people who have been there and done it before us, and actually to learn from some of the things that weren't well for them and some of the things they thought, perhaps on second thoughts, I'd do it a different way.